Hello, I'm Jay Davenport, Vice President of Development and Alumni Relations at VCU. And in this episode of VCU Voices, I'm pleased to welcome Dr. Art Kellerman, VCU's new Senior Vice President of Health Sciences at VCU and the CEO of VCU Health Systems. In these roles, Dr. Kellerman leads Virginia's most comprehensive academic health sciences enterprise, which consists of our 5 academic schools and colleges, multiple hospitals and outpatient clinics, including the VCU Medical Center, as well as the Massey Cancer Center and the Children's Hospital of Richmond at VCU. Kellerman previously served as the Dean of the School of Medicine at the Uniformed Services University of the Health Sciences in Bethesda, Maryland, which is the Leadership Academy for Military Health and the U.S. Public Health Service. Kellerman served in that role since 2013. Art holds Bachelor's of Science with distinction in biology from Rhodes College, a Doctor of Medicine from Emory University, and a Master's of Public Health from the University of Washington. Art, thanks so much for joining us today.
Thank you, Jay.
So to start with, I think everyone would love to know what drew you to a career in medicine.
Well, Jay, I was born and raised in a small town in East Tennessee, 4,000 people. And I'm a first-generation doctor, but a fourth-generation businessman. And the family's business has been going now for 125 years. They make cast iron cookware. So I learned the value of hard work and taking care of your community and taking care of your employees from my dad, who learned it from his dad, et cetera. But I was really drawn to medicine by a couple of GPs in the town, one Black and one white. Dr. Moore, the Black doctor, was one of my father's best friends and really became a second father figure to me and was a huge inspiration for me over the course of my career to do what I do now. Jimmy Havron was the lead doctor in town, white doctor, who was in a group that had a small community hospital. And Jimmy actually let me work 2 summers during college in the hospital as what they called an orderly, which back then, and it was a few years ago, meant that I got to do everything without 1 day of formal medical training. I got to take x-rays, I did lab work, I ran errands, I staffed the ER. They even let me give shots, believe it or not, and a few other things. You'd never get away with that today. And I loved it. And so between Jimmy and Hiram, I disappointed my dad and said, no, I'm not going to come back and work in the foundry. I'd rather be a doctor. He was a little disappointed at first, but then he said, I get it. And was very supportive after that.
So what drew you to VCU?
Well, as you noted, it was a roundabout journey, which it typically is at this point in life. I spent my first 25 years backtracking after medical school and residency and a master's in public health degree at UW. I went back to Memphis for 8 years, then to Emory for 17, first as a division chief and director of a city EMS service and an ER director. Later at Emory, I founded a center for injury prevention in the School of Public Health and was kind of drafted into leading and ultimately establishing a department of emergency medicine. But then 10 years ago, I got the itch to do something different. And I joined the RAND Corporation, which seemed like a great idea, working for a think tank. I mean, after all, it's a think tank. You must be really smart to work for a think tank. And that led to 3 major moves in 3 years. That got me kind of out of the think tank mode pretty fast. And I realized I was really more cut out for academic medicine, which led, because I was in DC, to an opportunity to work at the most unusual medical school in the country, at the Uniformed Services University, where I got steeped in military culture, but more importantly, I worked with young men and women who were really dedicated, not just to being wonderful healthcare professionals, but to be patriots serving their country. I did that for 7 years and loved every minute of it. But when I got pinged about this opportunity and I looked at what VCU is doing in Richmond, I looked at how Richmond is transforming as a community, and I realized in the VCU health system and our health science schools, I could have the best of Emory University's mind-bogglingly sophisticated university hospital and the beating heart of Grady, Atlanta's downtown public hospital, in one institution. The best of the best for everybody, but also the safety net for those who really need a safety net. that was just too good an opportunity to pass up. And to get to live in Richmond and to get to work with the caliber of the people we have here, I just thought, I'm actually coming home. This is my first time in Richmond to live, but this institution and what it does has been a part of my background and my DNA since the first days I walked into Emory to go to medical school and did my clinical work at Grady.
Now, joining an institution is always an interesting process, but joining during a global pandemic has had to have been the most challenging arrival ever. Tell us about that arrival, what you were faced with to start with, and then what are you seeing as next steps? What's next in the pandemic and what we're facing here at VCU?
Well, Jay, I joked with people that, taking on the job of being CEO of an academic health system in the middle of a pandemic would be a little like being told, you get to be the captain of this ocean liner. You've got 4,000 passengers on board and we're sailing into a Category 5 hurricane, or we're actually probably at about a Category 3 when they helicopter you on board. But the reality was VCU Health System had done magnificently during the first wave, and we're very well positioned to handle the second when I showed up. I saw major, wealthy, deep-pocketed health centers around the country laying off hundreds and sometimes thousands of staff in that first week or two of the pandemic. VCU didn't do that. They stuck by their employees and they stuck by the community. They adapted on the fly. They put in new systems and new techniques. It was a remarkably enterprising and resilient team. And I joined them and they had already hit their stride. So I didn't do a whole lot of meddling with the leadership team because they were working well with each other. And they had a team of doctors and nurses and respiratory techs and everybody focused on the mission. Third wave was a huge challenge. And believe it or not, dealing with the politics of immunization when we had very little vaccine early on and so many people desperately wanting it, that in some respects has been the most challenging part of all. But what a great crew. Now we're in a different place. We are out of the just getting beat and how are we going to handle so many critically ill patients. But now we're in an interesting point as a health system, as a Commonwealth of Virginia, and as a country, where it's a race between our countermeasures to both control the pandemic and ultimately to get people vaccinated, and the virus's ability to mutate and create dangerous new variants. So we are all in everything we can do every day to get people vaccinated, and we're begging everyone, and I would beg anyone and everyone watching this interview, please keep wearing your mask, keep watching your distance, keep washing your hands. Wait on indoor public gatherings until you are vaccinated and fully immune. And then you can relax a little bit. Even then, continue to do all the other prevention steps until we have really put COVID in the rearview mirror. If we let down our guard now, we're sick of this virus. We're all sick of it, but the virus is not sick of us, and it's relentless. So we have to be smart and we got to be disciplined, but we can beat this. We are winning the fight, but we're not knocking it on its backside right now. It is a race, and it's going to require all of us to remain focused and disciplined to get through this.
That's really, really good advice. And you've had the opportunity to meet one of our alumnus, Danny Avalon, who is spearheading our efforts here in the Commonwealth. So how has that working relationship been? Danny's
magnificent. I mean, he's everything you would want in an alum. Enterprising, upbeat, courageous. He embodies what public health needs to be about going forward. I actually met him before I even started. He was one of the people on my list when I snuck into town just to kind of get to know people before I officially joined VCU. And we hit it off on the first visit. And so at this point, if Danny calls me and said he needed me to do something, the answer is going to be yes. And then it's just figuring out how. But by the same token, if I call Danny and say, here's how you can help us, I know he's going to do everything he can too. Partnerships, alliances work that way. But I have the highest regard to him, and I'm proud that he's an alum of this institution.
He's a shining example of what VCU is all about. And I know that he has spent countless hours with your team, people around the state, and then also even with the university leadership team to help us understand what's going on across the state and in the area. So
yeah, and what Danny understands, and we really appreciate it, is that, we, particularly VCU, we not only could immunize many of the most complicated and fragile patients in Central Virginia who all come to VCU because they have those health conditions, and pull them in a safe manner and vaccinate them in a clinic with people that they know and they trust. But also we are doing outreach to the East End, the Health Hub at 25th Street, and other areas where we could go out based on our reputation and credibility with the community, built by Cheryl Garland and others, to reach people who might not otherwise trust the system. Mm-hmm. They do trust us now. And that trust has been built over years and years, but it's paying off when you get people to agree to be vaccinated. It's just a no-brainer, but yet people are reluctant, and we have to respect that and work through it. But that is an area, again, where VCU as a university, our School of Media and Culture, our education school, and others are partners in that enterprise and helping figure out how to craft those messages and win people over.
So your time here, like I said, has been one of the most unique entries I've ever seen in somebody in your role. But during that time, what have you seen that has really impressed you that you want to expand upon at VCU? And then what do you see as some of the opportunities for both the health sciences division and the health system going forward?
Well, in terms of what impressed me was, again, the fact that this institution and this university are such engines for the transformation of Richmond, and in many respects, the transformation of Virginia, all in a positive way. And it is an institution that's dedicated to giving every young man and woman a shot, not just handpicking the legacy kids or the best connected kids, but a place where anybody with a dream and a vision and a willingness to work can get ahead. And that's really what inspired me to come here. Health system is the same way. All right. And we have this amazing downtown campus that is surrounded by a set of really high caliber health science schools. And there are many institutions that don't have the main university just a mile up the road, a walk from here. That was just the catalyst that allowed was amazing. And in Richmond, this is not a big city, but it has the amenities of cities with millions and millions of people in them. Symphony, museums, great restaurants, and the warmest, kindest people I have ever met. Heck, even the city employees are easy to get along with. And every time I've dealt with them, I've never had public employees this nice. And they go, well, that's just the way we are here. So everything about this place, my wife and I really love, and we really believe in the mission. Opportunities going forward, there are a number of them, but really what I'm saying to folks here are VCU and Richmond and the Commonwealth are small enough that a person with skill and ideas and energy working with this team can make a tremendous difference, but big enough that that difference will affect healthcare delivery, not only in one of the nation's most strategic and important states, but it'll transform healthcare delivery and ultimately public health for the country because we can set an example. And what we're doing in Richmond today, what VCU is doing before I got here, and we're just trying to accelerate it, is to transform the history of the Commonwealth, which was not always positive. There are dark parts of the chapter, both of Richmond's history and of Virginia's, but going forward, we're rewriting that history literally day by day. And that is incredibly exciting and giving everybody in Virginia a shot, not just the ones who have means today, but the ones who have been waiting for their chance, and we can help give it to them. So that's what makes this place so unique and so remarkable. And building the chemistry between the Monroe Park campus and those remarkable schools, undergraduate and graduate, and bringing their talent to the health system and to our health science schools and vice versa, really becoming one VCU. What has been a slogan in past years, a reality today, is what I think is our greatest single opportunity. It is our secret weapon. We're in a tough neighborhood. We're going up against some very formidable, deep-pocketed and competitive health systems. and we have to compete with them. But what we've got on our side is a university, a credibility in the community, the tremendous support of donors around Metro Richmond and the Commonwealth, and we have the right mission and the right ideals. That's a pretty tough combination. When you get it cooking right, we're going to be unstoppable.
Absolutely. Now, one of the things, to future cast, once we're past COVID-19, or let's say that it's under control and there's some semblance of a new normal that we can establish, what do you see as your priorities for the health system going forward?
Well, I like to think of it in three buckets: tactical, operational, and strategic. The tactical are those short-term got-tos, and those are pretty obvious. We need to finish the adult ambulatory pavilion, that phenomenal high-rise clinic facility that's going to support a lot of Massey Cancer Center's outpatient work and other specialty programs. That is an amazing facility. The Wonder Tower for Children's Hospital of Richmond. Those two building projects are historic for Richmond and for the Commonwealth and the programs that they represent. And we want to make sure that Massey Cancer Center gets comprehensive cancer center status and that CHOR becomes one of America's truly great pediatric facilities, not just inpatient, but outpatient care and all the rest. We are also putting in a new electronic health record and a new workday personnel system. Most health systems do one of those things in that 3 or 4 year period. We're doing them all concurrently in the middle of a pandemic. So that's the tactical stuff. On the operational side, we know we have to do a better job of improving people's ability to get care from us, whether it's as an outpatient, new coming into the system, somebody who needs an appointment, getting it in a timely manner, but also people who need the absolute expertise, that life and death care that only VCU Medical Center can provide. And right now, we're pushing very hard to make sure we can always say yes, no matter how heavy the demand and how complex the problem. We're also committed to just improving the experience of care. Mm-hmm. That's not just the doctor that you see or the nurse, it means everybody on the team, the whole cast. And so we've got a campaign to really make sure all of our employees know, from the valet parking folks who help you when you're in chronic poor health and you're trying to get into the building on up, that we're all part of that team and that everybody affects how a patient and their family experience what we do. We're going to do a better job of aligning the academic and the clinical sides of the house so that our trainees get better education and our teachers and our patients get great care every single time. And strategically going forward, we say VCU Health, we don't say VCU Health Care. And so taking that VCU quality today of high-tech, life and death, super complex care, and saying we're going to do just as well at keeping the community healthy, embracing and promoting public health through colleagues like Danny Avalon and others, making a primary care network that is aligned with community practitioners who could see us as a backstop and a resource to them, earning the loyalty and alliance of community-based health systems around the state, not trying to take people over. We don't have that kind of money, and that's not the kind of folks we are, but becoming allies to key hospitals and health systems and clinicians in the Commonwealth who can always look to VCU for that backstop when they need it. That's really, on one hand, very straightforward. On the other hand, it involves a paradigm shift in thinking, not the way most health systems in America work today, and always, always, always remembering at the end of the day, our goal is to deliver fantastic value, innovation, and strength to the Commonwealth, its citizens, its families, and its economy. And if we do our job well, all of that will work beautifully and this place will prosper.
One of the things that I think is always interesting when you think about the different executive roles that we have at the institution is where our various leaders find inspiration for themselves or their units. Where do you find your inspiration? Are there particular thought leaders or areas that you go to, or is it in higher education, medical centers, outside of those two units?
I get my inspiration from walking around, listening to our staff, talking to patients, engaging students and residents and fellows. Their energy, their ideas, their commitment just gets my juices flowing. And I've learned, this video notwithstanding, the more I keep my mouth shut and listen, the better ideas I'll get, because people will give you those ideas as they describe what their challenges or frustrations, opportunities. I also like talking to alumni and donors, both those who say, hey, let me tell you how great things are, but also the ones who say, look, Art, you got a problem. You need to fix this or you need to fix that. It's those critics that help raise our game. We learn more from our shortcomings, by and large, than we do our successes. So really, it's coming from the people that we serve that gives me the energy and the inspiration to do what we do. And that's been true my whole career. Almost every pivot point in my life has either been a doctor that I worked with and learned from, or a patient who profoundly affected me in one way or another. I don't see that changing going forward.
That's incredibly insightful. And in your role, the ability to even walk around and interact with both patients and our staffs, our physicians, very, very important. And it is funny, I've actually been over on the MCV campus and have actually seen you walking around interacting with individuals, and people really enjoy it. They like interacting and seeing the leader, if you will.
Well, that's another blessing of having gotten the vaccine when I was able to, because, you know, I do feel a little more comfortable and able to do that now. I still wear my mask, I still watch my distance, I still elbow bump instead of handshaking, but at least I can get out of this office and do what I love to do, which is mix, mingle, and learn.
That is wonderful. Now, I'm going to give you a special treat now. I'm going to give you a special magic wand. And if you could, for a moment, if you could wave a magic wand and change one thing about the American academic medical health system, what would that be? What would you do to revolutionize the system that you work in?
Well, I'll cheat slightly and give you two. The practical one is really easy. Better parking. I don't know anybody in the planet that wouldn't say you need better parking in academic medicine. But by the way, that's the reason why these two new facilities have gorgeous, easy to get to parking decks right beneath them, and zwoosh, you go up in an elevator and you're at your appointment. But that's always been a challenge, and it always will be. The other would be, if I really could wage a magic wand, it would be that we would make the system more affordable. And that is a goal and a commitment that we have going forward. Because the more efficient we become, both at preventing and intervening early in the course of disease, when we even have a complex patient, right is usually the simplest, most straightforward way of doing things. We will not only save the patient, we will save a lot of money, and we'll save a lot of time in the hospital, and we'll prevent a lot of complications. So if we could make medical education and education in general more affordable, so students don't graduate with high debt, we can tap the donor community and philanthropy and others and work on a federal level in terms of public policy to make education more affordable and healthcare more affordable, then we'd be cooking with gas. But that will require a magic wand, because those are big lifts.
That is so true, but so important. And it's one of the things that I'm so proud of at VCU, the commitment from our alumni and the community in supporting access for our students. It's very, very powerful. Well, the way I love to close these is asking about something that might surprise people about you. Tell us something about yourself that people might not know and people might find interesting.
Well, I guess I thought a little bit about this question. I appreciate the heads up. And what most people would not realize in a health system CEO is that, having grown up in that small town in East Tennessee, in a poor rural county, we had a carnival that would visit every year, you know, with merry-go-rounds and Ferris wheels and things. Well, one year, one of the acts was a wrestling bear. And my oldest brother and his buddies kind of dared and goaded me as a senior in high school to wrestle the bear. The bear won. I'm alive. That's about all I can say.
Well, That's a very, very unique story, and fortunately, the bear didn't do too much damage, so that you could be with us today.
No, I always thought it would be a great thing to do because I could say I wrestled a bear, but I didn't last more than a few seconds, and I was flat on my back with a bear on top of me, and I said, "I'm out of here. I'm done." But it was hilarious at the time. Thank goodness it was before people had videos on their cell phones, or I would be living in infamy today.
That is so true. You know, growing up in Texas, when I was a kid, it was always the calf scramble. I don't know why, but every father in Texas insisted that their children try to wrestle a calf at the calf scramble. And I am also very, very happy that video doesn't exist. So,
well, you know, there's an old saying where I grew up, and that is the famous last words of a young Southern male is, "Hey, everybody, watch this." I
so
lived
true. Well, Art, I truly appreciate you joining us today. We're so happy to have you as part of the VCU team, and thank you for all you're doing during this very trying time. It's a great testament to you, and also a huge benefit to all of Central Virginia.
Well, thank you, Jay. It's an honor to be a part of this institution. I got to say, you know, I've had a long and rewarding career, but I got to VCU in Richmond as soon as I could, and I'm glad I'm here.
Very well. Thank you so much, and I'll talk to you soon.
You too. Thank you.